Hello! Okay, so I wanted to do a little bit of vlogging around the process of my upcoming carpal tunnel surgery. For those of you who don't know, carpal tunnel syndrome is essentially a repetitive use injury, and it's whenever you use, your hands repeatedly and then you get a thickening of like the fascia or maybe the tendon. I might have to Google that, I'm sorry. That puts pressure on the carpal tunnel and the median nerve that runs through it, and you get pain, numbness, and tingling in your hands, mostly in like these first three fingers. And I have had carpal tunnel syndrome for years. I've known that I've had it. I used to write a lot. I've written books and songs and poems ever since I was a little kid, and I used to handwrite everything in a notebook for years and years and years. I just liked being able to carry it around and get in a quiet environment and just sit there and write and write and write. And I used to fill up notebook after notebook doing this. And eventually, in my older, slightly wiser adult years, I started using a laptop because it dawned on me that I'm going to have to type all this up, and I don't really have a great attention span to sit and type up, long notebooks full of things. So I eventually did switch to a computer, especially when I noticed, my hands kind of hurt a lot after writing. So I did that, and then I started crocheting end of 2013, beginning of 2014, and once I latched onto an interest, like I really latched onto it, and that was my thing, was crochet. So I learned as much as I could. I crocheted up a storm. Eventually, like by the end of 2014, I was doing craft fairs, and I had like a business and all this stuff. So there were periods of time where I was really crocheting and pumping out products and stuff, and I would essentially blow out my hands and I'd have to stop crocheting for weeks, and then eventually when things like that would happen, the time would get longer and longer that I had to stop crocheting. Eventually I had to stop crocheting altogether. I don't think I've crocheted hardly anything in the last year, almost several months, and that was really bumming because, for lack of a better word, I don't know if that's even a word, but anyway, because I crocheted for my mental health as well as just for the fun of it. It was very soothing, that repetitive motion, but at the same time that repetitive motion would hurt my hands after a while. I get the numbness and the pain and the tingling. You wake up in the middle of the night with my hand hurting, and the braces weren't helping, and so I just stopped crocheting, thinking that that was going to stop the carpal tunnel pain. I did kind of start dabbling in sewing, but that's not as hard on my hands because, you're using a machine, and I just avoid pinning when I can. But it's kind of gotten to the point where it's affecting my everyday life. Just brushing my daughter's hair for very long, my hand starts going numb. Driving the car for very long, holding the steering wheel, I have to keep constantly trying to switch hands and stretch because my hand starts hurting, it starts going numb and tingling and unpleasant feeling. And just everyday things, dropping things all the time. And so I finally went and got a nerve conduction study done. I went to my doctor and said, look, I cannot take this anymore. So they did the nerve conduction study and confirmed that I had carpal tunnel, which I knew. I've got moderate carpal tunnel in my right hand, which is my dominant, and then I've got milder carpal tunnel in my left hand. So I got the nerve conduction study, got the results, and then they referred me to an orthopedic surgeon. And they actually scheduled my surgery for last month, and then like 2 days before there was a hiccup with authorization from another specialist, so it's been moved to this month. And finally we're 2 days away from the surgery. I'm really looking forward to it. It is going to be open carpal tunnel surgery, which I know that there is also a laparoscopic version that they can do. Some surgeons, including mine, prefer to do the open because whenever everything's more open, you can see you can see the whole area. You can see if there's maybe a cyst there that might be putting pressure on the nerve, and sometimes that can cause the symptoms. And also evaluate and see if there's any more damage there, and make sure that everything's taken care of, and it's just more thorough, I guess. They said that I should be good to go back to my job at the fabric cut counter in maybe 3 to 4 weeks. I initially was just going to do a medical leave for a month, and I decided to just go ahead and leave my job and take the entire summer off, so that way I have definitely enough time to heal, and then I can just spend the summer with my children. Sorry, a little low battery. Ugh. So that will tell me exactly, you know, time, I guess, will tell me exactly how long it's going to take me to heal. I know everybody is different. When I had foot surgery, it took a lot longer for me to heal than they were anticipating, so I'm going to just say that I'm a slow healer. But I will update the day of the surgery, and then probably ever so often after that, just to kind of keep people updated on as to how the surgery went, how I'm healing, what I'm able to do with my hand at what point. My stitches are coming out a couple weeks later. Like my surgery is on April 20th. I get the stitches out May 1st. If that makes any sense. And then after that, I should be a little more free reign with what I can do, as far as, you know, being able to shower without a bag on my hand. I have to be at the hospital on 6:30 Thursday morning, and then they said that's an hour before the surgery, and then it's like the surgery is less than an hour, and then an hour after that for recovery, and then I get to go home. And it's just going to be a local. They're going to put a local in my hand, and then I'm going to be on like the twilight sleep, which I had that whenever I had my foot surgery, and I did not wake up, so I'm hoping that's going to be the case, because after being awake during C-sections and stuff, I'm like, just knock me out, please. I don't want to wake up to that. I like, you know, I'm one of those weird people that I like watching, you know, surgical procedures and stuff on YouTube, because I just find it fascinating. I've always been like that, but whenever it's being done on me, it's like, no, just put me off to dreamland and we'll be good. And while I'm under, I'm getting a steroid shot in my left hand. So hopefully that will help improve this, and then they're going to get me a better brace, because braces did nothing for this hand, but maybe we can improve this one a little bit, even though this one's not as bad. So anyway, well, that's kind of the deal. There's not really much else to say at this point. I'm really excited, kind of nervous, because, you know, it's surgery and all that. They're going to cut you open and ooh, but you know, it's a good thing. It's a minor surgery, and hopefully one that will have a huge impact on my life, and I can get back to crocheting and sewing everything that I want to sew without having to worry about avoiding those pins, and you know. Anyway, thank you for watching. Bye.